Hello, my name is Christopher Dooley. I'm a Special Olympics athlete from Upper Shore. Today I am interviewing Dr. Satyarengga.
Hi Chris, how are you?
Fine.
Well, thank you for being here. So today you can ask me anything. Chris here is my patient. He's been diagnosed with diabetes, type 1 diabetes specifically, just recently. So I know you still have a lot of questions you have in mind. So ask me anything. This is the perfect time to do so.
So, let's get it started. What is diabetes?
So diabetes is a fairly common condition. It's a condition where your blood sugar is very high. Now in a normal person, blood sugar is very controlled, usually 100 to 180. In diabetes, your blood sugar can go much higher than that, 200, 300, even 400. And because of that, this high blood sugar will eventually does a lot of complications to your body.
How did I get diabetes?
We're still learning on who does get diabetes and who doesn't. We know in type 2 diabetes, typically the patients are older and usually have obesity. Now, in your case, you have type 1 diabetes, which is a very different condition. There is a theory that it might be genetic, it might be inherited from parents, for example. Data shows when one parent has type 1 diabetes, there's a 5% chance that the child will also have type 1. If both parents have type 1 diabetes, that risk goes up to 30%. So there's still a lot that we don't know, but in your case, it might be a combination of maybe you have some genetic factor as well.
What is blood sugar?
Now, blood sugar is, remember, you've probably done this at home when you check your prick and you use your glucometer to check your blood sugar, and it will give you a number. Now, this number cannot be zero. It has to be maybe 90, 100, 120, 150. And blood sugar is very important for life. Your brain needs blood sugar, your heart needs blood sugar. But in diabetes, this number goes really high. So it's higher than what your body required. And instead of helping your body, it actually causes issues with multiple organs.
What is a glucometer?
Now, glucometer is this device. So this is glucometer. This is what we use and what you use to know what your blood sugar is. I mentioned normal blood sugar is anywhere between 100 to 180 milligram per deciliter. In diabetes, that number can be really high, 200 to 300, and you don't want to be that high.
No.
When your blood sugar is that high, 200 to 300s, you want to start treatment. So this is very useful to know where your sugar is now. And then sometimes the blood sugar also changes. So occasionally I will ask you to check more than once a day because with certain foods, certain activity, your blood sugar can change. It can be anywhere from low blood sugar, normal blood sugar, high blood sugar. So very important device. And you've used it yourself, right?
Right.
Yep. So that's a glucometer.
How many times a day should I check my blood?
Right? So as a newly diagnosed diabetes, you should check at least once a day. Now, I always tell my patient, check it at multiple times of the day. When you wake up, next day maybe check it before lunch, next day check it before dinner, and next day you want to check it before you go to bed. So you have different time of the day because sometimes your blood sugar is good in the morning, but a little higher during the night, and it's always better to know what your pattern. Also, before you do any type of physical activity, let's say you want to exercise, you want to practice, you want to know what your blood sugar before, because with exercise, your blood sugar will tend to drop initially. And so you want to make sure that your blood sugar is good to begin with, not too low. And also after you exercise, you want to check to make sure the blood sugar is still within normal range. One other thing you want to check, if you feel a little off, when your sugar goes too low, for example, you're going to start to shake, you're going to sweat, you feel really hungry, feeling really tired. You want to check your blood sugar to know how low are you. Same if you think your blood sugar is really high, you're urinating a lot, you want to check your blood sugar to know where you're at. Is it 200? Is it 400? Because the treatment are different.